Good evening and welcome to Democratic Television. Television by Democrats for Democrats. I'm your host for this evening show, Doug Veum, and I'm here with my guests, Jeff Eastman, who's the CEO of RAM Remote Area Medical, and also Anabel Evora, who is the Chief Philanthropy Officer, which means that she's here for the same purpose, but she wants to plead for help with you, from you guys. Tonight we're going to learn about all the services that RAM provides to our community, what we need in the community, or what our needs in the community are, and how RAM fills those needs. With a continuing effort to repeal and replace the Affordable Care Act, the issue of the need of medical services is once again front and center, and as always, Remote Area Medical has stepped into the breach to do much of what otherwise would not be done in delivering medical services to all of our residents, regardless of their economic situation. We're going to skip any announcements that we might have had tonight because we've got a long thing, we've got a lot of stuff to cover, but why don't we start? Jeff, why don't you tell us a little bit about yourself, a little bit about the RAM itself, and then we'll let Anabel tell who she does, what she does, and where she fits in this whole thing, and where we go from there.
Well, first of all, thank you for inviting both of us here today. It's a pleasure to be here. I've been volunteering with Remote Area Medical for a little over 9 years. I'm not a medical doctor. I actually started out quite a few years ago. You had to bring a doctor if you wanted to volunteer as a general volunteer, and I got my sister to come down from New York State to LMU to volunteer so I could take along.
She went to LMU so you could volunteer at RAM?
It's amazing what family will do for family. Started out as a hall monitor. They eventually needed somebody to volunteer in the vision lab to put together glasses. I knew which end of a screwdriver was up, and so I went and volunteered and kept volunteering and talk about upward mobility. Eventually ended up as the CEO and I retired from my other career.
Kind of bootstrapping, right?
Absolutely.
Yeah. All right. Well, Anabel?
Thank you so much for having me and having Jeff here as well, and letting us really talk about what we do. I have been with the organization for the last year, and I came to oversee the communications and the fundraising department. I came from New York, and even though it's been a change, there's no other place that I'd rather be than working for Remote Area Medical. What we do, how we operate our free mobile medical clinics that provide free vision, dental, and medical services to anyone, whether it's women, men, children, families, individuals who do not have access to a doctor or cannot afford it. I just could not think of any other place that I'd rather be than just be here. People should have the care that they seek, the care that they need at no cost to them and without any hassle.
Well, how did you find out about it?
I was referred by a very good friend of the organization who has known and worked for the volunteered for the organization for many years. And I had a conversation with Jeff and Stan Brock over the phone about an hour while I was in New York.
Just Stan Brock.
And yes, and I just couldn't believe it. And within 2 days, I was on a plane. I was flying to Rockford, Tennessee. I was in Rockford for 4 days, and 2 months later, I've been here ever since.
It appears to be, just from your own experiences, that being a volunteer is a pretty important aspect of Remote Area Medical.
She forgot to mention that I needed her for 4 days to come volunteer and help organize my database or donors, and she came down and volunteered for 4 days, and like a lot of our staff that comes up through the volunteer ranks, she was hooked, and I'm happy to have her with me.
I can tell that she's having a good time as well.
So,
well, now I know that you guys, let's talk a little bit about what RAM does. And I know that you had a clinic this weekend in Blount County, and maybe let's use that as just a kind of a description of what does a weekend with RAM look like?
From the patient point of view, weekend from RAM starts out, and most of our clinics are 2 days, Saturday and Sunday. We volunteer doctors, all volunteer, general volunteers. Patients will come to the clinic this last weekend at Blount County as we were unloading the trucks to set up 40 dental chairs. Patients were already in the parking lot Friday afternoon. They wait in the parking lot till midnight. We'll let them come in, it's amazing they form their own little community. These are total strangers come together, but they look out for each other, make sure they're all lined up, make sure nobody's skipped. At 3 in the morning, we start passing out numbers in order. At 6 in the morning, we'll start calling those people in to registration. There's no pre-qualifying. If you're in need,
just be there.
If you just be there, and if you're just there, we will take care of you. Right. And we give out the numbers based on the providers that are there. And they'll come in and get registered, go to triage, and then off to the areas of service that they need.
How do you now? How does someone from Blount County know that you was it a Heritage High, by the way?
Yes, sir.
Okay, I've ridden a bike out of Heritage High. That's a great place to start. How does someone who wants to participate, wants to be there as a patient, how do they know you're coming?
Good question. It's very much a team effort. Anabel's department absolutely reaches out through social media. She also aligns with news releases to the local media. This time of year, my favorite way to communicate is flyers in kids' backpacks.
Okay.
And
Okay.
parents look at those flyers and see what's going on.
How do you get them in there?
Schools, we just talk with the school board, the school principals
Okay.
in Blount County,
Yeah.
Knox County, and align with them.
Yeah.
Also reach out. There's usually that person in the community, whether it's Hispanic community, church, Democratic Society, any type of associations
Sure.
to reach out
Sure.
to get patients to come in.
Right. So in other words, our monthly meetings would be something that you would use to communicate to a number of people.
Absolutely.
Okay.
And then your circle of friends
Right.
and your circle of
Exactly,
friends, because there's nothing worse than having a party and nobody show up.
Right.
So we absolutely.
That apparently doesn't happen anymore.
We hope not.
And now you say they show up at midnight, did you say?
Oh, they'll show
or
up
6
the
in
day-
the morning, yeah.
Yeah,
6 in the evening.
they'll show up the day before. I've been
Yeah.
at clinics on Friday, and somebody's been sitting there since Thursday
Wow,
afternoon in a tent waiting.
That tells you a little bit about the need. We're going to talk about that in a couple of minutes. Okay. Now, how serious are the problems that were brought to you at Blount County are and others? I mean,
Well, one individual that we spoke with, she was married. She was in her late 60s. She owed $800 for a crown that was done, but needed more dental work, and she just couldn't afford to get it done.
Right, yeah.
So she came to us. Our patients are your favorite waitress. In fact, my favorite waitress,
Yeah,
I live in
yeah.
Athens, was there. This is
Okay.
the second time at one of our clinics. She needed one more tooth pulled so she can have a set of dentures made. And hopefully in the clinics that's coming up in July in Athens, Tennessee, we will make her some dentures. There's always, when it comes to dental health, that's can lead to so many other things, heart failure,
Yeah.
very serious medical conditions.
Sure. Oh, yeah.
For children, for kids and adults, being in that classroom, not being able to see,
Yeah.
it impacts, the performance that are at school.
Right.
If I may add,
Yes.
one instance we were at a clinic and I had to go out and get coffee, and I went to a McDonald's, and the lady who was at the window, I was in our Jeep that has our logo, and the lady who was at the window recognized us, of course. She had been to one of our clinics.
Wow.
And shared with me she had gotten a whole set of dentures. The reason why she was working at that McDonald's was because she was able to smile and felt confident enough to go to a job interview at McDonald's. So that is part of there's a huge need on the healthcare side, but as well as the economic side.
Oh, I know Jeff's talked about the fact that you've got a wide range of people from a wide range of economic situations. Some are working, most are working, I guess, is that right? And yet they still have an access to the
It's
connectivity.
not just low income, it's also middle class.
Yeah.
People that do not, there's 108 million people in the United States that do not have dental insurance.
Yeah, 108 million. That's a third of the population, yeah.
Yes, it is.
Yeah.
For example, our clinics this year so far in East Tennessee, 40% of our patients have been employed, full-time or part-time.
40% are full-time or part-time employees?
part-time
Okay, right,
employees.
yeah.
30%,
And that they bring their kids too,
they
don't
bring
they?
their kids.
Yeah.
They bring their kids. 30% either unemployed. But what really strikes you hard is that 5% of our patients are veterans.
Yeah, that's amazing. Wow.
And around 50% are disabled that you would think would have safety nets.
Yeah, right, exactly.
But that's
Now say that one again. How many are disabled?
About 15%.
15% of your clients are disabled. They're not programs that work for them, is what you're saying.
Either don't work for them or access to them. A lot of times there's barriers.
Yeah,
If you're depending on friends and family to get you to a doctor's office Monday through Friday, those friends or family are working.
Right.
So it's really a barrier for you.
One thing you also said earlier is that, or to me you said that time off is an issue as well, so that the weekend clinics work for that as well, don't they? Yeah, okay. I mean, the needs are enormous. I mean, I don't know how we're going to cover all those needs because there's just so much of it. I'd like to talk a little bit about your history now. How old is RAM? How did it get started? And how did you, I mean, you're an enormous organization at this point. How do we get there?
Well, I'm going to deflect to the founder, Stan Brock, who 32 years ago founded us. Stan spent his formative years in his early 20s down in Guyana running the largest cattle ranch in the Western Hemisphere.
Okay.
Vaqueros were the cowboys. And all the cowboys were actually Amerindians. So all the cowboys were Indians. They always wanted to prove the new person's worth, so they said, oh, yes, Stan, you pick yourself a horse. And they gave him a horse. It was Cain, which means the devil.
Okay, all right.
He mounted the horse, slammed him in the corral, and just busted his leg all up.
Oh, no.
And he asked him, where's the closest doctor? And they said, oh, it's 26 days by foot. 26
days.
Okay. Later on, Stan was talking with Ed Mitchell, a famous astronaut who's now deceased. And Ed said to Stan, he said, Stan, I was on the moon. I was only a little over 3 days away from healthcare.
Yeah.
But for many people in this country, they might as well be on the moon.
Yeah.
And Stan decided that he was going to give back whenever he could. So when he was done with his great career in Wild Kingdom in Hollywood, he started Remote Area Medical. So one of the first clinics was a bus load of nurses to Mexico. One of the other first ones was just Stan and some great volunteers in a pickup truck and a big dental chair going up in the hills of Appalachia to make a difference.
Yeah. Bootstrap again. Really bootstrapped operation.
Yes.
I mean, so in other words, he recognized the need from his own need in a sense. I mean, he was 26 days by foot away from medical care. All of a sudden, that's a pretty bad situation, particularly when the astronaut is only 3 days away and he's 240,000 miles away.
Correct.
RAM was originally formed. His vision was to give back to the Amerindians of Guyana, but he discovered there was such a huge need for health care in this country that we still do overseas, about 10%, but 90% is domestic operations here.
Because of the need. Okay. Let me see. Is there a way to describe how big you are? How big is the organization? I mean, you run a clinic every week.
The best way, it's not how big we are, it's what do we achieve.
Yes.
So let me tell you about last year. 2016, we delivered over $10 million worth of free medical care.
Okay, that's a way to measure,
to over 32,000 patients.
All right, that's an even better way to measure, 32,000 patients.
But it wasn't our small team staff of a couple dozen at headquarters. It was over 10,500 volunteers.
Wow. And how many of those are medical versus people that support them?
I really can't break that down.
Okay.
I don't. I could dive into the numbers, but in my mind, every volunteer is important.
Right. Well, I was
volunteer is.
What I was thinking is that a dentist may need a couple of people volunteer to make sure that he gets full use of his time while he's there. Yeah.
Everybody from the blood bucket brigade to the hall monitor where I started to the patients on Friday night out there.
One of the things you said to me also is that when a dentist or a doctor or a medical professional comes to the clinic, they're ready to go. The clinic's set up, it's staffed, there are people behind the scenes that are making it go. So it's a pretty complex operation, but it makes for the professional can give, if he's going to work 10 hours that day, he's giving 10 hours of professional service.
Professional time. I believe that people inherently want to give back. And that medical provider, that dentist, that optometrist doesn't have to organize, doesn't have to gather equipment. They just have to come, do their great work, and go home. Because we actually have two events going on. We got this great event for the patients, but people don't recognize we've got this great event going on for the volunteers.
Yeah, to keep them at
we want to make sure it's a great event for both of them.
How did you wind up, you're both not Knoxvillians. I'm not a Knoxvillian either, but I came here. How did RAM come here?
Stan always says he just ran out of fuel in his airplane and he landed here.
Okay.
So that's the story, and I'm sticking to it. I don't know any different.
He ran out of gas at Island Home.
Island Home, and here he is.
Okay, so it's, I mean, basically that's, I mean, there's no story behind it other than just that.
That's it.
Well, we're pretty lucky to have this.
We sure are.
We are
Yeah,
extraordinarily
Yes, we are.
lucky.
Yeah, I mean, I have friends who are out at Island Home, and so they kind of, I think they kind of feel connected to RAM in a way that maybe those of us who aren't as close as do. And of course, that so it's always on their mind, and it's something that's a pretty big operation and something that's really important, and they are proud of it.
When you come to one of our clinics
Mm-hmm.
and you actually get to see and meet and the people who are actually there,
Mm-hmm.
we have about an average of 800 people who come during our 2-day clinics.
800.
800. That's on our very low side.
Right.
We're probably a little bit higher than that. But when you come to one of our clinics and you see the impact and how people are grateful
Yeah.
that they have an opportunity to come and get the care they need, you're hooked.
Yeah, you mean as a volunteer?
Yeah, as a volunteer.
Okay, right. Now, we're going to move on from this, but if you have 800 people coming, how many people come to a typical dental clinic over the course of a year? How many do you have any idea about that? I mean, it seems to me like 800 could be a year's worth of business.
Right. We do about 60% is dental, so you figure we did 32,000 patients, so you know what that breaks.
18,000?
Yeah, roughly.
19,000? I mean, that's a big practice.
That is.
Yeah.
And
on any given day, it's a big practice.
Yes.
Okay, wow. See, I'm trying to get that into perspective. Okay, another question that my friend asked me, or I asked him, I said, where do you suppose those dental chairs come from? And where does all this equipment come from? How do you get it there, and who owns it?
Well, it gets there through the generosity of donors.
Okay.
We accept no government funding for our clinic operation.
Right,
It's all donors, whether small individuals, corporations, foundations. We purchase the equipment. It's all foldable, collapsible, portable. We actually have 4 complete clinics we can set up. We keep a box truck with 20 dental chairs in Virginia, a state-of-the-art custom vision lab, which makes up to 350 pairs of glasses on site. And we have 3 other units in the warehouse. It's a great team that it's kind of like the circus.
Yeah,
you know,
okay.
it's
Good
all
point,
on
yeah.
wheels. It loads up. It's very methodical. Everything on the trucks is planogram where they go, and they get loaded and unloaded. We get more efficient all the time. We're down to about 4.5 hours. We can take a parking lot. We can take a high school. We can take the Smoky Stadium and turn it into a clinic site.
So if you can get enough volunteers, it works.
It totally works.
Yeah,
It totally
okay,
works.
right.
That's really the
Volunteers and money.
Right, exactly right. There you are. Well, the thing now, you talked about you've got a vision clinic, which means that when you go there for vision, you get a set of glasses that matches your eyes.
Yes.
Okay, I'd always kind of figured you were handing out Lions Club glasses. You're not.
We make them on site.
Yeah.
And during those 2 days, close to 400 pairs of glasses
You're right.
are made.
But they're made to prescriptions.
Yes.
You get a full eye exam.
Yeah.
We have thousands of frames donated from great partners, from Walmart, your Costco, your independent
Right, the frames,
optometrists,
yeah, right.
And then the lenses.
But the
they're
lenses you
right
guys
there. They shape them down. They start out about the size of a donut, and they get edged down to fit your glasses.
And we make them in less than an hour.
Yeah, that's amazing. yeah. Okay, right. Now there's some people that learn from you. Yeah. How far in advance do you plan for these things? In other words, the when you were in Blount County last week, when did you start doing that?
Probably last year. We're sitting down and going through requests. RAM doesn't charge to come to your community. You could be that person in Knoxville and wanted
Our listeners could be that person.
You could be that person to have a clinic.
Yeah, okay.
And you just go to our website, pull down Bring RAM to Your Community,
Right.
fill out a form. We send you a little starter kit, let you know the basics, and if you continue on, we send you a step-by-step manual.
Right.
So we're starting this year for next year. We have over 50 requests that we can't fill, despite my capacity.
You mean communities that want your service?
Over 50 every single, and it's incremental. As we get bigger, we get more and more requests, and we actually have to turn down more and more. So it takes up a good year of planning.
You guys are 2 full-time employed people. How many others are there like you? Because it sounds like you got an enormous staff of volunteers.
Last year we had right around 24.
That's it.
Yeah.
To run all that. To run
a few
all
more
of this.
in the pipeline for this year as we expand our operation.
Sure. Wow. How do you? You talked about how you get patients to know about what's going on? How do you get medical professionals to kind of know? Is that a network that they have themselves, or what do you do for that?
This is my network right
Oh, there it is. Okay.
Yeah.
You're knocking on doctor's office doors and things like that?
It's a few things. One is the organization has a great reputation.
Yes,
we
I
have
know
been
that.
doing this
Yep.
for 32 years. We
Right.
are the pioneers
Right.
of free mobile medical clinics. And a lot of it is that people, there's a lot of people that know us.
Yeah.
They've come to one of our clinics. They see what we do, they see the impact, and
Sure.
they come and they travel with us wherever they're allowed to cross state lines.
Right, you talked about that, yeah.
And we have right here in Knoxville, Tennessee, one of our volunteers, and she has been with us since clinic number 1, since expedition number 1.
Medical professional.
Yes,
Yeah.
a dental professional.
Yes, okay,
medical
right.
Yes. And we're now at 850, clinic 850, 851. So you can imagine.
Sure.
She has been to our clinics, almost all of them.
The whole time.
Particularly here in Tennessee.
Yeah.
So we do a lot of outreach in the community through the media as well. And now we just have a great database as well of medical practitioners,
Right.
and they let other medical practitioners know as well.
Yeah, okay. So there's a network amongst them.
Right. In addition to Anabel's great team reaching out, we've got a great volunteer team,
Yeah.
and their task.
Yeah.
Actually, we were a little short for dentists 2 weeks prior to Blount County, and they got on the phone and they started calling people,
And they-
calling
okay,
providers.
right,
They also go to great conventions and trade shows,
Okay.
and reach out
Right.
and touch those
Right.
professionals across the U.S.
I mean, the constant need for services, and it makes a constant need for people to provide them. So, and that's what you guys do essentially.
yes.
It's not hard to get the people to come and take the service. One other question I had: what do the non-medical people do? I mean, I know you've got medical people, and you had a lot of them, and you got people behind them. But what kinds of things do they do?
Does everything from patient registration.
Yeah.
Hall monitor on that, to on the dental floor, it can be the bucket brigades.
Okay.
We actually, and the vision lab, it's very similar to Henry Ford's process. It looks complex when you look at it, but there's about 12 steps.
Yeah.
But if your step is just moving this lens and dotting it,
Yeah.
the next person traces the frame, and we train them how to do that. If they can train me to run the vision lab,
Okay,
we
so
can train anybody.
you and I can do that.
We
is what
can
you
do
say.
it.
Okay, right. Well, so so that's what people do. Our listeners could volunteer by going to the website.
Yeah. Go on the website, volunteer, create a profile, what their skill set is,
Yep.
and then just keep up with it and sign up.
And one of her people will call you.
Well, actually, it's, in Taste Technology, I don't give her many people.
Okay, right.
Their staff is small.
She
on
calls
top.
you. Okay, right, yeah.
They'll get an email. They'll get a text on their phone, and they'll be able to be connected on that. Absolutely.
The 800 people who you serve, or whatever number it is, it's a big number.
That's an average.
That's an average.
That's an
Okay, right.
average,
That's
yeah.
average. Okay. And they start standing in line the day before. So why do you think they do that?
They can't afford it. They cannot afford it.
Okay.
They don't have. They want to get care. They want to be healthy. They are willing, and you really get that they can't afford it
Right.
when they're willing to be there.
That's what
Not only a couple of hours,
Yeah.
12, 24 hours
Yeah.
before we even open our doors.
So it's a really graphic, demonstrable show of need.
and
the
and
need
not
is
only
real.
that, they're also in pain.
Yeah. Okay. That's
They
right,
are
too,
in
yeah.
pain.
Yeah.
If you've ever had a toothache, you
Yeah.
know that just disrupts your
Yeah.
entire being and your entire day.
Yep.
And if you can't see, you
You
wear
can't see-
glasses.
I do.
If
Oh
you
yeah. No.
can't-
In
you
fact,
know, then you need to be able to operate. You need to be able to just to live your life.
Exactly,
You can't live
right.
your life if you don't have just that basic care.
Exactly. In fact, just about not being able to see, last fall, I had cataract surgery, and I have insurance, so I had it done, and I got new lenses. But I had a period of time there where my glasses didn't work, and I couldn't see, and that was 4 or 5 weeks. That's a long time for me not to have seen. Changed my entire life. I will tell you that.
Well, imagine that there are 22 million people, I believe, that have never had an eye exam.
Yeah,
The
wow.
National Eye Institute
Yep.
predicts that by 2030, there's going to be an enormous amount of millions of people that are
Right.
actually going to suffer from
Sure.
cataracts.
Yeah,
So.
that many, yeah. In fact, because because baby boomers. I'm a little older than that, but they're coming behind me, and they're going to be doing that. That's right.
We're right behind you.
You are, yeah. You're not far away, yeah.
You touched on need, and it doesn't make any difference where you are. I mean, I've been at clinics, Anabel both have, in Orange County, California, some of the richest pockets in the United States, and we had to turn patients away.
Yeah, wow.
We've been up in Signal Mountain.
Yeah.
People coming over.
I live in Signal
Dunlap,
Mountain.
Whitwell, up that way. On that. So there's, wherever you throw a dart, you will find people that need help.
So why do you think why are we as a country, and maybe this is something you don't want to answer, but it just comes right as you talk about it to me. Why do you think we're so reluctant to provide those services, something other than what you guys do? I mean,
that's a great question.
That's a great question. There's as passionate as I am with this organization, with Anabel is, we would love to be out of business.
I've heard Stan talk like that as well. Yeah.
Because we have great other programs. We have a great youth program with Ram Rangers.
Right.
We would love to say everybody's got health care. Now let's go focus our mission on developing youth.
All right. Now you have a lot of professionals who work for you. What do you think when they come to you and they spend a couple days, they've got to realize that, man, there's a lot of need out there that I'm not even able to touch at all. What do they think about this, do you think?
The biggest thing they like is they don't have to do any paperwork.
Right, yeah.
They get to come because those professionals, they care.
Yeah.
And it gives them an opportunity to care. On the business side, we have great professionals here that actually will come by headquarters, that actually come by, volunteer. Well, actually, we've got Ron Brewer and Chris Hall. That if they got something that we can't take care of at a clinic, they'll pick up the phone and they'll make some phone calls. There's great providers. And one thing that we do is bring the community together at clinics to provide some follow-up care.
Okay.
So it's just helping people navigate those people that will really help them in the community.
And I think the other thing, I'm sorry, it's we call them our RAM humanitarians because they are truly humanitarians.
Right.
They are there. They want to give back.
Yeah.
And they see it, they feel it, they experience it. The people who come to our clinics, our patients, are so appreciative, and there's such dire need, and their circumstances are so strenuous sometimes that just even if it's one person, that medical practitioner just gets it and gets moved by it.
Well, that's what I'm thinking too. I mean, you've got an awful lot of people who have been touched by you, who are the providers just as much as those who are the patients.
Absolutely.
Yeah. And it still boggles my mind the fact that we don't seem to get the whole story. We just don't, and that's one of the reasons we want to have this show. One of the reasons we want you to talk to us about this, so we can show others what this need is, where it is and all. One last thing before we get too little time left. What is your biggest need, do you think? Is it for professionals? Is it for money? Is it for
it's all of the above.
All of the above, okay.
Yes, two things.
Okay.
We just need two things.
Yeah.
One is donations because we receive no government funding for our clinic operations. As mentioned before, it's those donations, and what really makes a big difference with us is people that want to leave a legacy.
Yeah.
So that their good work continues on.
Sure.
And we can honor them as moving forward. And the second one is volunteers.
Volunteers, yeah.
I mean, it's don't be afraid to pick up the phone, to go to the website, volunteer with us. It's a great journey. I've slept in my car as a volunteer everywhere from Tennessee to Oklahoma to California and back, and those are some of my best memories.
Yeah.
And if I may add, the 50 requests that Jeff was talking about that we're unable to fulfill, we would love to fulfill all of them.
Sure.
We get about close to 150 of them throughout the year. And last year we did 80 clinics. Imagine what it would be like if we were able to fulfill all of them.
Yeah.
When we do the math, we could be treating another 50, 60, 70,000 people in a 12-month period. That's our greatest need. How can we treat those people?
All right. Well, thank you both for being with us tonight. I would say to the audience, we're going to make sure you see this a couple of times and come back to see us next week. We're going to have some legislative follow-up next week. Thanks.